product list. Host system. Power cable. Tourniquets, 2 for each size 12, 18, 34. Soft gauze cover. Equipment bracket. Storage basket. Appearance introduction. Charging indicator. Touch screen. Air supply port. Brackets blend. Switch. Socket. Interface panel. Startup button. Manual button. Battery power. Operation guide. Back button. Equipment self-check. OK means the check passed. Left-right channel. Pressure value display. Pressure setting panel. Time value display. Time setting panel. Inflation-deflation control panel. System settings button. IVRA sync button. Automatic deflation button. Total working time. Pressure unit setting panel. Timing mode setting panel. System volume adjustment panel. Back button. Operation setting. Plug in the external power supply. The charging indicator is on to indicate that the external power supply is connected, and the lithium battery is being charged. Turn on the switch on the back. Click the Start button. The device starts to self-check. And the check has passed. Click the System Setting button. Set the pressure unit. Kilopascal. Millimeters of mercury. Set the timing mode. Timing. Inverse time. System volume adjustment. Slide to the right to increase the volume in turn. Click the Return button to return. On the pressure setting panel, click the up arrow button to increase the pressure. Click the down arrow button to decrease the pressure. On the time setting panel, click the up arrow button to increase the time. Click the down arrow button to decrease the time. Right channel, pressure rises and falls. Time increases and decreases. Click the IVRA sync button. The left and right channels are synchronized. The pressure rise and fall are synchronized. The time setting is synchronized. Click the automatic deflation button. After confirming to turn on, the system will automatically deflate after the set time. On the inflation-deflation control panel, click the triangle button to confirm that the device starts to inflate. At this time, the P into triangle and P into triangles buttons will appear on the inflation-deflation control panel. P into triangles means quick deflation. P in a triangle represents slow deflation. The total time of the left-right channel during hemostasis. The IVRA sync button and the automatic deflation button are turned on at the same time. At this time, the left channel and the right channel are automatically switched. When the set time for the left channel is up, the right channel starts to inflate. And when the set pressure is reached, the left channel is automatically deflated. Operation demonstration. According to the actual clinical needs of the patient and the surgical needs of the affected limb, set an appropriate pressure value. Maximum pressure value 650 mm of mercury. General upper limb surgical pressure less than or equal to 350 mm of mercury. Lower limb surgical pressure less than or equal to 450 mm of mercury. Set the time. Time setting range, 3 minutes to 240 minutes. The device has an automatic reminder function. There are 3 beeps in the remaining 5 minutes, 6 beeps in the last minute. When the set time is up, the screen will pop up the time is over interface and beep 10 times. The doctor selects a tourniquet of appropriate specifications and uses a cotton yarn that is larger than the width of the tourniquet as a pad to make the pressure evenly distributed on the surface of the patient's limbs. Improve the patient's surface pressure feeling. Check the effectiveness before use and make sure the air in the tourniquet is emptied. Then tie the tourniquet to the upper end of the patient's surgical site, in the direction of the heart. The middle fixed adhesive tape buckle is fastened and fixed. And the fixed horizontal strap should be tightened and fixed. Insert the hose plug of the tourniquet into the air supply port of the device. Click the triangle button on the inflation-deflation control panel, and start inflation after confirmation. The inflation is completed when the pressure value reaches the set value. And during the operation, the pressure can be increased, decreased, and time adjusted at any time. At the end of the operation, choose fast deflation or slow deflation according to actual needs. Remove the tourniquet and pads to complete the operation to stop bleeding. Pull out the hose plug of the tourniquet after venting. And turn off the switch on the back of the device.